of who they are. In my role as a CEO, I don't have the privilege to serve patients directly, but I like to believe that I am helping other people help seniors become better.
Thank you, Ms. Price. Ms. Edwards?
Hi. My current role right now, I currently work in a emergency room setting. I currently work with Prisma Health, Toomey in Sumter, South Carolina. My primary role as a psychiatric mental health nurse practitioner, I am the one that you will see if I am consulted from an ER visit. Generally, if I'm seeing you, it's because it's a psychiatric emergency. I am the one that's going to help, along with a psychiatrist, help determine whether you can be seen within an outpatient setting or do you require an inpatient hospital admission. I also do medication management as well as I do addictions at LORADAC, PRN as needed. And I am also trained to do Suboxone therapy for those that may be struggling with opioid addiction. And I also do some parts of counseling as well when I'm doing an intake in the emergency room. So, thank you.
Thank you, Ms. Edwards. I love that we have this diversity of disciplines represented here. As was discussed, I think it's important to recognize that you can have people with varying degrees and experiences and credentials all doing very similar things, so thank you all. So y'all ready for our discussion? Okay, let's get to it. So the first question, what are some ways that we can work on eliminating the stigma of mental health in our community? And I'll open it up to whoever would like to go first.
No, I would. And I wanted to go first because I am no longer providing direct services like I used to. I don't have the private practice anymore because I've moved in different directions. But because of the stigma of mental health, I've just felt a strong pull to remain in the role of an advocate. And so I often will work with community organizations and churches to educate folks about what mental health is, because mental health is health. And I think these forums, this virtual symposium today, is one of the best things we can do to begin to break down the stigma. And so and I also think the more we talk and clarify misconceptions and myths, the more people will understand what we do and the more comfortable they will feel. The other thing that I think is helpful is if we could normalize help-seeking behavior by talking about it just within the course of normal conversations. And if we can stop making jokes about people when they are acting in a way that's strange or uncomfortable. I mean, saying words like this person is crazy and making gestures and using terms like psycho or psychotic. When we throw that around, it makes people really uncomfortable. And you just never know. So many folks, and I didn't do statistics, maybe you all do, but so many people, and it may be 3 or 4 out of 5, are seeing some type of psychotherapist or have some type of undiagnosed mental illness. So when you're making offhand statements that end up being derogatory, even if it's in jest, you end up offending people unknowingly. And that may not be an intention. So I think if we can begin to change our language when we're around friends or family, that's one step. I also have noticed that the more I talk with my friends and colleagues about challenges we face as caregivers and challenges we face in the helping profession, we all start talking about our therapists. And so just to be able to say to people that, yes, I am seeing a therapist. I started personally seeing a therapist probably 4 months ago. But I remember during the pandemic, I would talk with organizations, and when I did my executive coaching, I would ask many of the leaders how they're coping, how they're functioning. What is it that they are concerned about in dealing with their staff? And they all said the same things, that they were struggling too. And as they talked about problems concentrating, as they talked about feeling overwhelmed, I found myself relating. And I would share that with them. You know, yes, I do that too, because I wanted to normalize their experience. But after a while, I said, Leslie, you might need to talk to somebody. And the more I thought about it, it really resonated with me. And so as I started thinking about what I wanted to, in a counselor, and I knew I wanted to see an African American female, and someone with a strong faith, I said, okay, I'm gonna do this. And I know I have a different experience because I am in the field, but when I found someone, I had to wait maybe about a month and a half before I saw her. I was like a kid in a candy store. I couldn't wait for my first session. And I mean, it was a good experience, but I realized that most people don't have that because people don't know what to expect. And when there's a large degree of uncertainty, then fear comes in. And we kind of come up with all types of negative thoughts about, is this person gonna think I'm crazy? Are they going to think something is really wrong with me? Are they gonna think I'm weak? So I'm hoping that as we have more conversations about what therapy is like and how we really are here to help people, we can move past these notions that something is wrong when you want to seek treatment. Because therapy allows you to really grow and understand who you are, understand why you make the decisions you've made, and understand even some of your struggles. But it also, I like to say that therapy can hold up a mirror to you and your functioning. And that's what therapists do. They allow you to see how you show up to the world. And that may be quite different from your intentions. And then it gives you the coping skills to make some changes and really show up in the way that you think you're showing up in your head. You can actually begin to do that in person.
And as we think about mental health being stigmatized, we have to kind of take on some of that responsibility not to harbor self-stigma. You know, for us to feel like it's okay if we need to speak with someone. It's okay if I'm not feeling like myself, and making that normal, because we're all human. We all experience symptoms of anxiety. We get anxious, we get sad, we get overwhelmed. Those are very normal things. And Dr. Leslie spoke to making that a part of your conversation, sharing with people that you see a therapist, like normalizing that it's okay that when I'm not feeling well, that I can reach out to someone to speak to, because we do that when we have a headache, we do it when we have stomach aches, we do it when our blood pressure seems to be a bit elevated. We have no problem seeing our primary care provider when we have physical ailments. But for some reason, when we have some mental health concerns or mental health challenges, then there's a level of shame and embarrassment that comes along with that. And so not harboring on that and holding that within ourselves and again, self-stigmatizing ourselves when it's not necessary. I think that that's another way that we can normalize these conversations and normalize people seeking treatment.
Yes, absolutely. So engaging in conversation about mental health is certainly important. It helps to open up the conversation and not feel like you're walking on eggshells, because sometimes the conversation, it's too difficult to talk about in families. And it's been not talked about in our community. It's just been kind of placed under a rug. So it's very important to educate as well as set the precedence that it is okay to discuss your mental health.
Thank you, ladies. I love that, normalizing help-seeking behavior. I think I heard you all use the word normal about 4 or 5 times, and I think that that's what we need to do. Also looking at, preventative care. No one bats an eyelash when we go for mammograms or vision screenings, prostate exams. And I would love to see us get to a point at some point where we can look at just doing kind of preventative mental health check-ins. So thank you for that. Will each of you address the concerns that you have seen pertaining to mental health in the young adult population?
In the young adult population, currently, right now, what I'm seeing is that suicidal ideation has become like a #1 thing that I'm seeing in the ER currently. A lot of depression, as well as bullying, and along with keeping up with social media. I have a lot of just, seeing that a lot of the younger adults feel that they must keep themselves to a certain standard to social media. This is how I'm supposed to look, this is how I'm supposed to be, and again, it brings on suicidal ideation as well as depression. So it's very important to educate your children, your teenagers, that we all don't move on the same line at the same time. It's okay to do things at your own pace. Do not let social media determine your life outcomes. So that's very important.
Yeah, I'm seeing that in my community. In fact, I want to say even right before the pandemic, we were seeing, and I live in a small community in Pawleys Island, and there were probably 5 suicides within 2 years. And so, and I'm sure that it's indicative of the levels of depression and anxiety that young people are experiencing. And so I would encourage all parents, regardless of whether you think your child is functioning well or not, to have conversations about their understanding of people who are struggling. Did they know anyone personally who's committed suicide? What are their thoughts about that? Just have conversations with your teen and child. But before you can do that, I think you need to probably get some education about what is suicide and who commits suicide, which is everybody is at risk, so to speak. But to be able to start to educate yourself about it and open up the conversation. Notice when your child is withdrawing. Notice when they're staying in their rooms longer, or they're not engaging in the activities that they used to find enjoyable. And don't just attribute it to, oh, this is what teenagers do. And so I know it's kind of hard because, yes, some level of teenage functioning is being more independent and pulling away from the parents, but you should still be engaged with them. You still want to keep the lines of communication open. And you really want to make sure that they're still functioning well in school. And when I say functioning well, that means they're keeping up with their school. Their grades are not slipping. They're not skipping class. They're not deciding that they don't want to participate in some of the activities they used to enjoy. Because that's what we look at. We look at a change in behavior along several areas. And parents are the best sources of history for us. So as parents, you want to be attuned to that as well. And I think the more you can intervene earlier with kids, getting them to talk up, or maybe even asking a family friend to have a conversation, the more we can really begin to pull them back and not let them get so ingrained in that feeling that I'm all alone and this is all I have, and my resources and my options are limited, because that's what kids think. And that I think that's one of the things about suicide. When someone is in that much emotional pain, you can't see it, but they're thinking, and they're only focused on today. Things aren't going to get any better. So their ideas of what is possible is totally different. And so we're seeing a very limited sense of options for them. And this is really why it's important for us to be able to look for some of those warning signs.
Yes, and as Petra mentioned, the peer pressure and social media and the need to be successful, or the sense of urgency to be successful in young adults. And when we say young adults, that could mean 18 to 24. We would consider that the young adult range. And whatever success may look like for them. And we tend to have timelines as to when we should accomplish and achieve goals. And when we're on social media and we see our peers reaching those goals, at the rate that we believe is the appropriate rate, then we start to question our worth, we start to question our value, we start to question the contributions we're making to our community or to our families, and then that's when those symptoms of depression may come in. And as we've talked about suicide in this particular question, people choose suicide as an option when they feel they have no other options. And so as they're trying to reach their goals and be successful, again, whatever that term means for them, when they've tried everything they know to try and they're unable to attain that level of success, then they now feel that they are no longer valuable, and then suicide becomes their last option.
Thank you. Each of you referenced suicide. A few years ago, I believe it was in 2020, Congress had requested that the United States Department of Health and Human Services submit a report examining why Black children were dying by suicide. Black children ages 5 to 12 were dying by suicide at twice the rate of white young people. That was staggering, heartbreaking. It's hard to wrap our brains around that, right? And so, some of you talked about signs and things to look for, but are there any other suggestions that you can give to not just parents, but just people in general when they are interacting with loved ones where maybe there's some behavioral changes going on? What are specific things that parents should be looking at, that folks that are just in community with one another should be looking for in terms of people that may be suffering in silence?
I think one of the misconceptions is if you talk about suicide, you're going to put the idea in somebody's head. And that's just not true. And so being comfortable with having conversations about suicide, and the fact that many people are considering it as an option to have those conversations. It's okay to ask your loved ones, has there ever been a time where you thought you weren't needed here anymore? Has there ever been a time where you felt that you just weren't valuable anymore? And we have to be okay with saying, yes, there have been those times where I've just felt that I just was not of value. I think that people feel alone even when they're surrounded by many people. And having those conversations and making the conversations comfortable, I think that we're able to catch things a lot quicker. And doing check-ins with the people that we love, check-ins with people in our community, not just checking in saying, hey, how are you, but truly creating space and time to have difficult conversations is extremely important.
And just to extend the conversation of my sister, I just love the points that you just brought out. Sometimes we're just even afraid of acknowledging a feeling that we're seeing. And so when you see a child who looks sad, go ahead and say, honey, you look sad. What's wrong? Tell me what's going on. And it may take several prompts, but the more you do that, the more comfortable they will be in sharing their thoughts and feelings. Now, whatever they tell you, the important thing is not to be able to move forward into, well, you shouldn't feel that way. Now, it seems like that's the first thing out of our mouths, unfortunately, because we can't understand why that person might be struggling with those feelings. But when you say you shouldn't feel that way, it ends up invalidating their experience. And that means they end up feeling, oh, I shouldn't feel that way, so now I feel badly because I'm feeling this way. Something is wrong with me. But to be able to say maybe, well, help me understand why you're feeling this way. And you want to talk about what you could do that might make you feel better. Do you want to talk about, and just to begin to explore some options and leave it open. Also, when you're noticing whether it's a small child or a teenager who is looking angry or sad and you're having these conversations, try to resist feeling as though you need to have the answers before you have a conversation. Because I think that's another thing that stops us, is we don't know how to stop someone who might be having thoughts of suicide, and I don't know how to stop a person who might be having thoughts of suicide. I know what the protocol is. So if you take that off the table and remove that pressure that you will be the one to save them, that you will be the one to have the solution, as opposed to let's have a conversation, number one, about what I'm seeing. I'm seeing your feelings, I'm seeing or noticing a change in your behavior. I'm really concerned about you. What can we do? How can we get some help? And then as you have those conversations, if this is not your child, to think about, okay, well, I'm concerned, so let's think about how we can talk to your mom about this. Let's think about how we can talk to your grandparents about this. I'll go with you. I'll help you. But this is not something that we're going to be quiet about or keep in secret. Unless, of course, we're dealing with some abuse issues, and that's a totally different topic. But we really want to create that safe space to be able to acknowledge what we're seeing and make it okay for them to share with us.
Yes. As you said, Dr. Leslie, allowing someone to create a safe space, that's very, very important. With your children, other things that you can monitor for or be aware of as far as suicide risk, isolation, things such as self-injurious behaviors. They may tend to cut themselves. They may tend to cut themselves where you can't really, see it because it's up under their clothes. However, that's a cry out for help. Also, not willing to or not wanting to engage with family activities, constantly just want to be alone. Those are things to look out or be aware of as well. And also, like your family history, things that increase risk for suicide. So if you maybe had like your sister or your parent who committed suicide, again, that increases the risk for suicide within your family. Please allow your children to feel like they can come to you in a safe manner, non-judgmental, and allow them to speak. And again, like you said, Dr. Leslie, it's okay to say, hey, why are you feeling that way? So very important.
Thank you for that. Can we, I think I heard you, Dr. Leslie, say anger. Can any of you just speak to maybe some atypical signs of depression? I think a lot of us are aware of what it looks like when people are kind of what they call down in the dumps, kind of sad and kind of mopey, certainly the isolation, but there are a lot of atypical symptoms of depression that can look like other things. It can look like defiance, it can look like oppositionality, which we end up having different conversations with our children around that. So can any of you talk to the atypical symptoms?
Well, anger is one of them, anger and irritability. And I think we all are aware of coworkers who are so irritable, and that's just part of, we say that's part of their personality. But it's not part of personality. There's a reason people are irritable. It's a reason they're shown up, and maybe it's, they've ignored some issues over time, or they're just not addressing what they need to address. But there's a reason why people are angry all the time and irritable. But I think that's probably one of the number one, atypical markers, is that irritability. And it's easy to dismiss that, whether it's in an adult or whether it's in a defiant 3-year-old, or even if we're dealing with a teenager who seems irritable and angry all the time. Sometimes people, and often people, put up a defense, and that's their hardened veneer. It's a way of protecting themselves. But of course, you start peeling back that layer of anger, you're going to get to the pain. But people don't want to walk around exposed, so they're not going to show that to you. So I think that's one of the major ones to be on the lookout for.
Thank you. How does depression impact our physical and our mental abilities?
Well, depression actually impacts our physical and mental abilities by not really wanting to do a whole lot. You may not want to get up and, get your day started. However, it's a grand push that I have to get up, I have to move. You may have changes such as within your sleep. You're either sleeping too much or not sleeping enough, as well as weight gain, weight loss. You're unable to concentrate. You just don't have the energy to go. Appetite changes, as I said, with the weight. Those are just some of the changes that you may see with someone who's depressed.
And she mentioned not wanting to get up in the morning. And so, yes, lots of times it takes so much effort. And if you're not depressed or you haven't worked with depressed individuals, you can't really understand what that means. But people talk about like they're wading through a heavy mass of water, and they feel as though a weight is on them. And so getting up means having to wade through all that to pull off the covers. And the whole idea of going through your morning routine is just so daunting and seems like it's just not worth it. So they stay in bed. Or there are times when people, we do, one of the symptoms of depression is lack of energy and lack of motivation. Well, sometimes they're very motivated, but they don't have the energy, or they don't have that psychological will to actually complete their to-do list. So although they said they were going to get up and shower and go out to do something, they just can't when they are trying to do that. And unfortunately, to family members, it looks like this person is just lazy. Because they're just sitting around, they're not doing anything, they're not cleaning up after themselves, they're not eating, they're not even, and they wouldn't eat unless you fix them some food. You know, when they do, you do fix it, yes, they might eat it, but all of those are indications that they can't do it for themselves. And so I think it really is important for family members to look up the descriptions of depression, because everything we've mentioned are real indicators that a person is struggling with depression.
Thank you. Let's talk just a little bit about the relationship between substance abuse and mental illness. Does substance abuse attribute to mental illness, or is substance abuse used to appease anxiety and anguish by folks that are struggling with mental illness?
Substance abuse can alter symptoms of mental illness. It can increase, it can make you psychotic. So when you engage in the use of substances alone on top of having a mental illness, it makes things like twice as hard. It makes being able to actually get a definitive diagnosis if you truly have a mental illness, because the substances are on board. And you do have patients who will engage in substance abuse because they are dealing with a mental illness. I hear a lot of patients say, I'm using this because I have bipolar, or I'm using this because I am anxious. So there are a lot of patients who may engage in substance abuse because they are struggling with their mental health. And therefore, it's also important that not only if you need to get help for your mental health, you need to get help for your substance abuse help. They coincide. It's like a co-concurrent. Those are struggles that a lot of people with mental health, they have co-concurrent disorders.
And I think that we try to separate substance use from mental illness, and it's important to note that there are substance use disorders, that your abuse of substances is actually a mental illness. I think that many people believe that people are just using substances because they feel like it, or because it's fun, or because it just makes them feel good, but it is an actual illness that they cannot fight through on their own, that it is indeed going to take treatment. And it's true that more than half of the people who have substance use disorders also have other mental health disorders, be it anxiety, depression. Some of it may be psychosis, personality disorders, and so they're kind of co-occurring disorders that they're experiencing. But I think that there's a stigma that goes along with substance use as well, and we need to make certain that we are treating individuals who have substance use issues as if they have an illness, opposed to them just deciding to throw their life away, or deciding to ruining their families, or creating or displaying criminal behaviors or activities. Just being able to say that these are not separate issues, that it's a true mental illness that needs to be treated.
And there are strong genetic components to these substance use disorders, and many individuals may not realize that. I was talking to a veteran last week who mentioned, he didn't talk about his family history, but just to speak to what you were saying, this is someone who has significant physical problems as a result of his drinking. He has tried to stop. And he's done so for a few weeks, but then he starts up again. So he wants to get healthy, but then he says, but I like beer. I like beer. And so the problem is people like what they're drinking, but they're unable to manage how much. The other challenge for a lot of individuals is there's a lot of socialization around alcohol use. And so when folks are socializing around it, one of the messages we get is, oh, just relax. You know, drink a glass of wine to relax, or drink whatever this, or why aren't you drinking around us? So there's a lot of pressure for folks to drink just to be sociable. And my thing is, okay, there's nothing wrong if you want to drink. Go ahead and say you drink because you want to, rather than you're drinking to be sociable. So the concern, and the reason I bring up this topic of drinking, is we're seeing a lot of women who are struggling with, it's like a slippery slope. You drink a couple of glasses to unwind, and then all of a sudden you're having problems sleeping, and you notice that you can't relax and you can't get to sleep until you've had your glass of wine. And then all of a sudden you're hiding your bottles of wine so that your neighbor doesn't see you putting it out at the trash recycle bin. So it easily slips into a problem. So we really want to be mindful of, if you're choosing to drink, knowing why you are drinking, recognizing how much you are drinking, and what is the impact that it's having on you and on your subsequent life.
Thank you. As we talk about treatment a little bit, can any of you speak to what are some of the medications that are being used for treatment of mental health issues? A lot of times people will, as a few of you referenced, will self-medicate with alcohol and sometimes with drugs. But what are some of the medications, legal drugs, that are used to treat various mental illnesses?
So there are an array of mental health medications that are available. The most important thing is that the individual is going to be compliant with taking the medication. That's the most important, whether it's a tablet or whether it's a long-acting injectable. So just in reference to, let's say, maybe, a depression medication, if you're going to take that for your depression, you may do well on the medication. However, with taking a medication, it's not a cure, it's to help minimize the symptoms of depression. So it's not curing it, but if you take it, it should help minimize the symptoms. And actually, even if you take the medication, you may be able to come off, like after a year of your symptoms being minimized or kind of subsiding. Now, like other medications, such as for individuals who may be dealing with schizophrenia or like a schizoaffective disorder, a lot of times the medications are an indefinite treatment. Although you may hear some patients say, hey, I feel better, I don't want to take my medication, and you have to reinforce with them that, hey, you're feeling better because of this particular medication. And again, there are what we call long-acting injectable medications that are available. You could ask your healthcare provider about the medications. You have medications that you could give on a every 2-week basis, even of every 3 weeks, or even monthly. But again, the key to treatment is compliance. No matter whatever you prescribe for the patient, the most important thing is compliance with the medication. Because you have some individuals who will kick and scream and say, no, I don't want to take that. I want to do my natural herbs. I want to, stay natural. And again, it's not helping with their mental health.
Thank you. Now, medication is just one aspect of treatment. What are some of the tools that are needed and steps to take when researching to find the right therapist? There are some conditions that are managed with a combination of therapies, medication, psychotherapy. Talk about that a little bit.
I think one way to find the best treatment or the best provider for yourself is to seek advice. Reach out to people who are in treatment, that you know are in treatment. And once you find a provider or many providers that you are interested in having appointments with, ask for a consultation. I encourage everyone to have those discussions with providers before committing. And ask, one of the big questions will be, do you accept my insurance, or are you private pay? How long have you been practicing? Do you serve people with my background? Maybe it's your gender, your age, your race, your religious beliefs. Ask, how long will the sessions be? How long will my treatment be? Will I have to see you for a year? Will I see you for 3 months? These are questions that we need to have in consultation, and then also know what type of provider you want to have. If you prefer to have a female provider and you visited a large group practice or a large doctor's office, feel empowered to say that I prefer to have a female, I'd prefer to have a male, I prefer an African American provider, I would prefer a Latino provider. Knowing what you want in a provider is the first step, and then ensuring that that provider is going to be the best fit for you, because this is someone that you may have to see long term, and you want to be comfortable during those appointments.
The other thing you want to ask in consultation is, what experience have you had treating this type of issue? Because not all therapists are experienced in treating traumas. And that's okay. That person should be able to say, well, this is what I've done, this is my specialty. Tell me a little bit more about what you're going through, about what you're looking for, and then they should be able to refer you to someone. But so you don't want to assume that they know how to treat whatever it is that you're going through. And you should be able to have a good discussion about, when you're treating this, what will we be doing? What does it mean to treat me for this? Just as you were saying.
Thank you. I'd like to actually move to our senior demographic. With medical technology being what it is today, we are seeing a growing number of older people living a lot longer. And as a result of that, we're seeing a lot more of our seniors having Alzheimer's or dementia or both. A lot of times we use those terms or those conditions interchangeably. Can any of you speak to the difference between dementia and Alzheimer's?
Yes, so dementia is, I guess, kind of like an umbrella term, just to mean memory impairment or memory loss. Dementia actually...
After the fact, after someone is already struggling with mental health or emotional issue. But again, it's so important to talk about preventative measures. I want to talk a little bit about self-care. We've seen Black women caring for everyone but themselves, the superwoman syndrome, right? And so many of us are wearing so many different hats and carrying so many different burdens. Can you talk about the importance of self-care, specifically with regards to Black women?
I think it's important to know what self-care is. A lot of us perform acts of self-care by maybe going and getting a massage or getting your favorite drink at Starbucks or maybe going shopping, getting a pedicure. All you're doing is making these companies rich. It's not truly self-care. It's nice to do, but it's not self-care. Self-care needs to be sustainable. Self-care is something that is continuous, and so we need to care for ourselves on many different levels. So there needs to be physical self-care, whether that's watching what we eat and exercising. We need to making sure that we get enough sleep. There needs to be financial self-care, making sure that we're budgeting and monitoring our spending habits. Intellectual self-care, make sure you're always learning something, learning something new, maybe going back to school, maybe teaching a class or teaching somebody something that we have social self-care, surrounding yourself around good people and great energy. If people are bringing you down, they don't belong in your circle. You're doing yourself a disservice to continue to be around people who drain you. And then also there's emotional self-care, and emotional self-care is scheduling that appointment with your therapist. It's maybe talking to your pastor. Maybe it's connecting with your loved ones that kind of feed your soul and your spirit. And so when we talk about self-care, we need to make sure that we're taking care of ourselves continuously and collectively, because all that's going to happen by us going to Starbucks is just going to create financial burdens because we're paying $10 for coffee, right? And so just making sure that it's sustainable and something that is going to make us feel good long term.
I love that. It's really about a holistic approach, and that's just what you described. And one other aspect of that would be setting boundaries. Setting boundaries along in terms of your time and what you're able to do. And as Black women, we don't do that. We feel as though we can't say no. And no can be the most liberating word that we use. I worked with one of my executive coaching clients on doing just that. I mean, that was one of the aspects. And she said to me, she said, Dr. Leslie, saying no has been liberating. I just feel so good, because she doesn't just say no. She says, no, but here's what I can do. Mm-hmm. No, but here's who you can call. Or here is how we can do something differently. So you're not being rude. You're not, just closing people off. But we tend to think that when we say no to people, we're not being nice. And that just goes against who we are. And I think it's time for us to challenge that. And even in terms of self-care, we think we're being selfish if we're going to deny our child this opportunity because we need to, take a few minutes for ourselves, and a few minutes could be 30 minutes to an hour to that day. Mm-hmm. So we have to start challenging, as you said, our own views and definitions of self-care. Absolutely.
Self-care is very important in our community. I don't think as African American women we do enough of it. It's very important to put yourself and say, okay, I'm going to put myself first. As I understand, I'm not a parent. However, I hear a lot of parents say, I have to do so and such for my children, and I have not had any time to do anything for myself. Mm-hmm. As I have understood, it's that you have to find time to care for yourself so that you can care for others. Absolutely. In our community, yes, we do carry a lot on our shoulders with making sure that everyone else is okay, and we put ourselves last. But then we are sometimes moody, mm-hmm. we are upset, we don't want to be bothered, and that 5 minutes in the bathtub along with the door locked, it's everything. But it is okay to take care of yourself. It's okay, like you said, Dr. Leslie, to say no. So definitely find time for self-care, and I'm not talking about a 1 hour a week. Find time to do things that's going to stimulate your mind and be what is of importance to you and your mental health.
Thank you. I love all of that. I always say I see self-care as a public service. I know when I do the things that I need to do for myself, I show up better for the people that I work with, the people that I live in the house with, and it just makes me be a better person. And so, I just always think about, what is it that I need to do so that I can be my best self for others. I love that. Thank y'all. Do you find, in the same vein of self-care, do you find that we often use self-care to mask or to temporarily solve the need for seeking professional help or therapy?
I would say yes, sometimes it's probably masked in our community. I would say a lot of people say, hey, I'm going to, as you say, go to Starbucks or go get my nails done because this is what self-care is for me. However, really on the back end, I really need to be sitting at the therapist's office explaining or talking about the issues that I have going on, because you can indulge in your $10 cup of coffee and say, oh, this feels great, drinking it, it's good, and I'm going to just maybe lay some of my problems in this cup. However, they're going to return after that coffee is done, and you still are having issues with dealing with the long-term problems that you are dealing with. So.
And I think also it's important to note that we can't assume that people know what treatment's available. And so for some people, they truly believe that self-care is the treatment for their depressive symptoms, or they believe that it is the treatment for their anxiety. Because we're all mental health professionals, we think that everybody knows where to find us or when they should seek us. But that's just not true. There are many people who are unaware of people that you can reach out to have these conversations with and know exactly what we do, which is why I so appreciate Tara in the beginning asking us, like in layman's terms, in simple terms, what do you do? Because there are people who just do not know what they have access to or what they could have access to, and self-care is their remedy because they just don't know anything else.
Thank you, Janae. Let's switch gears and talk about our Black men for a minute. How do we remove the stigma of Black men having to be strong and presenting as if there's nothing wrong? And then how do we give them a safe place to let their guard down?
I don't know the answer to this question, and part of it is because being strong for Black men is so much of their identity. And when we ask people to change their identity, their sense of being, that's going to be challenging. And so I think it's important for people in the community and professionals as well to understand that when we're approaching a person and telling them that their being is wrong, and how they identify is wrong, we're naturally going to have pushback and resistance. And so again, I don't know the answer, and I'm just going to have to be okay with being a clinician who doesn't know the answer to this.
Yeah, that's so important. I'm so glad you talked about identity, because I think it's to even address this issue, we have to maybe approach it differently. And so instead of, again, challenging someone's identity, to be able to reinforce the idea that help seeking, it takes strength, it takes courage to be able to go and seek help. And I think more Black men might be amenable to that if we start to address it from a different angle. And so I think it would be great if we could invite some Black men into this conversation and to be able to find out exactly what is it that challenges them about engaging in help seeking. Some of them are more aware and more open to engaging in therapy, but many others aren't. And I do think this is a conversation for both of the sexes.
As you said, I really can't really speak to the Black male in the African American community, but what I will say is that currently I'm finding that more African American males are more receptive to therapy. They're more receptive to counseling versus our grandfathers or our fathers. But the men right now, I'm finding that they're more receptive to therapy.
And I will even tell you this, when I told my nephews last year that I was looking for a therapist, The youngest one, who was 16, said, "Really? Why don't you just look at your notes?" And then he was 18, 19-year-old at the time said, "That's cool. I think that's good. Everybody needs some help. Everybody needs somebody to talk to." So I think if we can start kind of at that young age, really, it makes a difference.
Thank you. And it's important, you all talked about just not having the answers. And I think that that's important to acknowledge that, even as mental health professionals, we don't always have the answers. And so, acknowledging that is really important, and sometimes being able to relate to someone when they're seeking treatment, that honesty to say, you know what, I don't have the answers, but I'm willing to walk with you on that journey to try and get some answers is, I think, so important and so helpful in terms of earning trust of people that are seeking services from us. Next question. What can we do as a family or community to support those with acute or chronic mental health issues? And we actually touched a little bit on this, but just more specifically, what can we do collectively?
I feel that collectively, to help support, a family with mental health issues is that listen. Please listen to your family. Be non-judgmental. Allow them to share their feelings and do not jump to conclusions or say, well, you shouldn't feel that way, or, I don't, we don't talk about that kind of stuff here. Allow that person or the individual within that family to share their feelings, hear them out, be able to, offer support, which is very important.
And even let's talk a little bit about what offering support might look like. Maybe volunteer to go with them to a session.
Yes, absolutely.
So if you don't understand what they're going through, and maybe they're having a hard time describing that to you, and they say, you just don't understand, and say, okay, no, I don't understand, but maybe it'd be helpful, can I come to a session with you? I don't have to sit in for the whole session. I just want to come and understand what you're going through and how I can support you.
Yes.
And then as a community, I think it's very important to have symposiums as this, and for those of us with platforms with various organizations or in church communities, for those of us who are maybe educators who have large social media followings, it's important for us to use our platform to provide education. And as community members, when we see different symposiums or different events that are catered towards mental health, it's not just to go alone, but to take a friend. Because they can then share what they learned with their family members. And then we also need to seek out more events or symposiums that discuss mental health or mental health concerns. And as we're looking for fun things to do on the weekend, consider that a fun thing to do so that we can become informed to help those that we love.
Thank you, Janae. I think everybody is probably sick of COVID at this point, but we can't ignore the impact that COVID has had on us in so many different ways. What impacts have you seen that COVID has had on healthcare workers, certainly yourselves, funeral homeowners, preachers, pastors, folks that are just working daily and tirelessly, with over 6 million at this point Americans that have perished as a result of COVID?
Well, certainly COVID has taken a major effect on, I think, just about everyone, whether it's been that you're a healthcare worker, a pastor, you are working in a funeral home. It has caused people to, even if you were not depressed, you're probably depressed now because of the isolation that we have had to endure to help decrease the spread of the virus. Now, I will say, in reference to myself being an avid healthcare worker, we're exhausted. We are exhausted. We are, tired as well, but we're still in the fight. We're still trying to combat this illness, this respiratory illness, but it's been hard. It has not been easy, and there has been a lot of having to encourage your fellow coworker to say, hey, we're going to have a good day, we can get through this. But COVID has taken a lot of mental health. It has taken it in a different direction. It really has. Mm-hmm.
I didn't know if you wanted me to talk about this now, but.
That's fine, please.
Okay. But I actually have a little PowerPoint, just because there are some graphs that I wanted to share. I've been talking to a number of churches, including my own, about the impact of grief. And COVID.
Excuse me, Dr. Bessel, I just want to make sure that that we get those slides queued.
Sure.
We do have some slides from Transformations Consulting, if we could get those up.
Okay.
Thank you.
Okay, so yes, so I've been talking about understanding grief, and the pandemic has actually compounded people's grief responses to the point where I think more mental health professionals are seeing what's known as complicated grief. So I wanted to just quickly talk about what normal grief is. And that first slide kind of highlights that normally people tend to think that when you grieve, you're going to go through these 5 stages, right? And they think it's going to be like a linear approach, and that's just not the case whatsoever. That kind of research is outdated. There are a number of phases where you will or you may experience anger and depression and resignation and all that, but for the most part, you end up feeling like that jungle mess there, right? When you're going through the process of grieving, you feel like you're tied up in knots, and that's for a reason. So if they can advance the slide, what tends to happen is, I love that particular picture because it suggests that there's a movement through back and forth phases. And there are times when you are grieving and it feels like a flood of emotions is coming over you and you may be overwhelmed. And if you think about the waves on an ocean coming back and forth and back and forth, and sometimes it's low tide and you feel like you got yourself on solid footing, and then other times you get knocked over because those feelings are just, they come out of the blue, and that's how grief is. And so you may not begin the process feeling anger. You may start with just being irritable, or you may start with feeling hopeless. You may start anywhere with any type of negative emotion, and then you might move forward for a couple of days or a couple of weeks, and then all of a sudden you feel like you're right back to square one. And so people going back and forth through that end up thinking, well, what's wrong with me? You know, and they really feel as though they might be going crazy, okay? But that's normal for the context of grief. And so I really wanted to stress that. There are a number of things that you end up feeling, and you are moving toward the process of understanding how you're going to be in this world without your loved one, and that's a hard challenge. I don't like giving a time frame, but I have to for the sake of this conversation. So grief, the process can take anywhere from 6 months to 1.5 years or so. That doesn't mean that at the end of that time period, you're going to stop hurting, you're going to stop missing your loved one. But what that means is, at the end of that process, you should be able to make some meaning out of the loss. You should be in a process of adjusting to what being in this world looks like, and gaining a little bit more control over your feelings. Okay, and so that's kind of what the goal, and then you're adjusting to a new normal. And the next slide highlights what could happen. I think that's, so we're going to be on this one for just a second, because when you are grieving within the context of COVID has changed things, in that we have not been able to have the normal rights that's important. Not having an opportunity to gather with family and friends for that needed support, not being able to do the wake services, or even the normal or typical funeral services, has taken away a lot of our supports. And one of the things that funeral services do is that it actually has a psychological purpose, in that in addition to celebrating a person's life, in addition to reflecting on what that person meant to you, it allows you to really reflect on, first of all, the reality of death and the finality. And that process actually triggers kind of like the first process of healing. And so when a person is unable to go to that funeral of their family member or loved one, even if it's an abbreviated one, it takes away that process. And if you think about folks who lost someone to COVID and that person, the family members, didn't even get a chance to see the body because it had to be whisked away, that does something because you no longer have that process of saying goodbye. Okay, and it's totally different from going to the gravesite. But if you're used to this funeral rite that actually triggers the start of that psychological process of grieving, it prolongs the process of grief. And that's really what we're talking about. And so when it prolongs that process, then that means that you are sitting with that pain longer. You're not experiencing the closure that you need. And you're definitely not benefiting from that community of support, because being able to see how that loved one impacted not just your family, but the community at large is also helpful to that process of grieving. And so that can trigger the complicated grief, which is the next slide, which comes about not just from COVID. So I do want to say that complicated grief is prolonged grief. And it can come about because of lack of closure, as I just mentioned, but if someone experiences a traumatic death or a violent death of their family or loved one, that can trigger complicated grief. And if the death is sudden or unexpected, that can also trigger complicated grief. Doesn't mean it's automatically going to happen, but it just kind of increases the likelihood that your grief could be prolonged. And so when you're experiencing complicated grief, that means that you are having more intense emotions for a longer time period. So I gave you the reference of 6 months to about a year and a half or so, just so that you can get a sense. Normally, most folks fall into that category. When we're dealing with complicated grief, it takes years for a person to move through that process. So they're still feeling this intense emotional pain of loss. I'll never forget when my first job after my father died was at a counseling center at South Carolina State. And I remember taking a call from a young woman who said she was struggling with the loss of her dad. And as I'm thinking, okay, that's what I'm dealing with too. How am I going to manage this? She then went on to say her father died 10 years previously. 10 years previously. Okay, so if you're still struggling 10 years, then that's an indication that we're talking about prolonged grief. And what happened in the interim was so many people tend to avoid thinking about their loved one, or avoid, I don't have time to cry, I don't have time for this pain, I don't have time for, I'm just going to throw myself into work. That can trigger a prolonged grief process too. So this is why it's important to really understand that grieving has a purpose. And we want to make sure that we can grieve appropriately, that we can have the supports that we need, and that we can take the time when the feelings come to even just say, okay, it's coming, I just need to give myself 10 minutes to have these feelings, to feel these feelings, and then after 10 minutes, have a plan to shift and do something differently. Otherwise, you'll end up feeling all of those, yearning, the avoidance behavior, and even when you're this whole yearning for the loved one, that just means you kind of expect them to come in the door, you feel guilty about moving forward, you feel that if you move forward, you're going to forget them or you're going to betray them. And so then you feel guilty about trying to move through the grief process. So this is what we're dealing with when we talk about complicated grief. And in this case, this is totally different from normal depression or anything else. With complicated grief, you really do need to work through it with a counselor. Okay, and so when you're calling about that, then you really want to talk to and say and find out if your counselor has experience dealing with grief issues, because not all of us were trained to do that. Okay, so that's another thing to consider. But I really wanted to highlight that because complicated grief happens normally, as I said, but with the pandemic, we are seeing more people who are dealing with those issues and they don't even know that that's what's happening. And so if you recognize a family or loved one is still struggling to the point where, you know, they can't move on, they're not functioning well at work, they're not in, I don't want to say engaged socially because that's going to take a while, but they're just not moving forward as in a way that's healthy, and you see they're being compromised, then do have a discussion about how you can help them engage in a mental health professional.
Thank you for that, Dr. Leslie. I think it's so important that, you know, when we think about grief, it is such an individualized process. Everyone grieves differently,
Yes.
in different timelines and time frames. It's interesting when, you know, I think, you know, all of us probably at some point had some training in the stages of grief. And, you know, of course, you know, intellectually, you know, it sounds good, you know, it's in a neat box, but anyone who has ever grieved knows that it's not linear. I've had lots of conversations with clients about sort of using the analogy of a lazy river, and kind of, you know, you're on your nice little tube and you're floating along your lazy river, and, you know, all of a sudden out of nowhere there's a wave that comes and it just rocks you to your core. And grief is very much like that. It's very individualized, and it's hard, especially when you are dealing with people, whether it's professionals, whether it's family members, neighbors who are invalidating of where you are in your grief process. So thank you for that. I'd like to talk a little bit more about anxiety. Again, COVID I have seen in my practice unprecedented levels of people coming in with anxiety, 5-year-olds and 7-year-olds and 60-year-olds. Let's talk about the difference between nervousness and anxiety. Anxiety is a term that is thrown around quite a lot, but let's talk about the difference between clinical anxiety and nervousness. Can anyone speak to that?
I think one of the biggest differences that we should consider, whether it is a clinical anxiety or a mental health concern, is the duration. We all get nervous, but your nervousness should be temporary. Your nervousness should also be triggered by something. You're about to have a speaking engagement. It's natural for you to be nervous. It's your first day of school. It's natural for you to be nervous. But when you start to think about the mental illness of an anxiety disorder, whether it's generalized anxiety or some other illness, it's the duration. How long has this been happening? Is it excessive worrying, constantly feeling senses of like doom, or that something is going to go wrong, or not being able to, I guess in simple terms, not being able to shake the feelings of being worked up or constantly feeling on edge. So it's important, again, to look at the duration, because everybody who's a human being is going to experience symptoms of anxiety. It's just normal. You're going to worry about things. You're going to feel nervous. Things are going to put you on edge, but there should be a trigger to those things, and it should be short term. There doesn't always have to be a trigger when we're experiencing true clinical anxiety. It's just something that's with us on an ongoing basis.
Thank you. I want to talk a little bit about some of the situations that we've all seen in the news. There have been probably in the last year at least 3 that I can think of, situations where someone is having a public or made public by virtue of a cell phone or camera, having a mental health crisis, and the police get involved. Can you all speak to why is it important to inform the police that there's a mental health crisis in the home prior to them coming when there is some sort of interaction that is turning volatile?
It's important to notify the police of the situation that they are going to approach, that there's a person here with a mental illness. It makes them aware. It makes them be able to, have a different approach versus if it was a situation that was very dangerous. However, they may have a mental health professional who's going to come to the call with them. So it's very important to at least give them a call and say, hey, I have someone here who has a mental health diagnosis or it's a mental health crisis, so that he or she, once the law enforcement arrives, that they will have a precedence of kind of how to deal with the situation at hand.
And more than of knowing how to deal with that situation is understanding the behavior of the person that they may encounter. And so if there is someone with maybe psychosis, they may run, they may charge towards you. And so what they may see, as law enforcement may see as aggressive behavior, this is their natural response due to their illness. And so making law enforcement aware of the mental illness, and hopefully law enforcement having someone trained within that department who can educate the officers prior to going out, or who could be with those officers as they go out, which I've not seen before. I'm not saying that it doesn't exist, I've just not seen it. But I think that, again, it's important to know that an individual has mental illness and understand their normal responses to things. Because, unfortunately with police brutality, a lot of times it's because someone isn't being compliant, or they're running away for whatever reason, or they feel that they're charging towards law enforcement for whatever reason, and not taking into account that this is their natural response because of what they live with.
Thank you. And as I'm listening to you all talk, I just think about the importance of our resources. When we look at where our funding goes, there are communities where there is funding allocated for folks from the local mental health agencies to be able to go out with police to be able to address those concerns. So again, those are issues that are, again, important in being able to adequately address mental health. I want to talk a little bit about PTSD. What is the best therapy for people who have been incarcerated or who have PTSD? Can anyone speak a little bit to that?
Well, I know there are different modalities for PTSD treatment. I don't know about the aspect of your question related to incarceration, but I know that there are a number of trauma-informed therapies that are available for PTSD. One of them is prolonged exposure therapy. But there are other therapies that are also being researched and trialed. There are other approaches that are more effective for certain folks, depending on the nature of their PTSD. And so I just think that's based on when we see a person in therapy and we're doing the assessment and we recognize where the trauma came from, how it originated, as well as the person's background and history, then a decision is kind of made as to which type of treatment is going to be best for them. It's one of those areas, again, where I say if you're seeking treatment for PTSD, to be able to ask the provider, what are the types of treatments that you will make available? What's your success rate? What contributes to people doing better in one type of therapy or another? From what I understand, if I can recall correctly, with the prolonged exposure, part of the success rate has to do with the individual's history and their ability to kind of tolerate reliving some of those experiences. So there are certain things that therapists look at when they're making a decision as to whether they should use this type of therapy versus another type.
Thank you for that. We started off talking quite a bit about kids, and I'd like to go back to our children. Our children, we are at a place where there is bullying occurring at astronomical rates. Can any of you talk to how bullying affects young people's mental health?
Bullying actually affects the mental health a great deal in young people. It makes them, not want to engage in school, as well as it makes them isolate, as well as it may increase thoughts of suicide, because it's saying that I'm a target. I don't know why, but I'm a target of someone, and it makes it very hard for the individual to deal with when they're being bullied.
Thank you. Will any or all of you explain the difference between autism, attention deficit disorder, ADD, attention deficit hyperactivity disorder, ADHD, and a person or child having BAD, just being bad?
I'll speak to children being bad. I personally don't believe that children are bad. I don't. It is normal for children to have tantrums. It is normal for children to have outbursts. It's a part of development, child development. I believe that when children are misbehaving, it's a sign of an unmet need. And so whatever that need may be, the need may not be necessary in our eyes, but for them, I have a need, you haven't met it, and so a way to get the attention to get my needs met is to misbehave. And a lot of things that children do, all of the things that children do outside of eating and jumping when they fall is a learned behavior. And so at some point, we have either shown them that this is how you behave when you have an unmet need, or we've condoned the behavior before, and in turn they have learned that this is the way that I present when I want this thing to happen. And so if we have bad kids, it's our fault.
Amen. And if I can just speak to that really quickly, I just think it's so important to, again, as we start talking about language, is to separate the child from the behavior. Looking at a bad child is different from saying this child is engaging in some undesirable behaviors. And so, our language is powerful, and it's so important to be able to frame things in a particular way.
And sometimes kids can get away with behavior at home, and when they go to grandparents, they can't get away with that behavior, right? And sometimes children, again, engage in certain behaviors at home, and then when they're out in public, the parents are like, oh my gosh, because they're looking and seeing how other people are responding to that behavior. So you're absolutely right. All behavior is purposeful. It doesn't mean that kids are willful, but they have learned, as Janae was just saying, they have learned that I have to do this in order to get somebody to pay attention to me or to do something for me. I will talk about the distinction between ADD and ADHD. So these are our attention deficit disorders. The attention deficit means that there's a part of, well, I won't go into the biological part. I'll just say areas related to impulse control, regulation of our emotions, and our attention are affected. Okay, it's affected in our brain, in the executive functioning of our brain. And so when a person has ADD, then that means it's attention deficit disorder without hyperactivity. And in this particular case, we see kids are easily distracted. We normally will see those with ADD are kind of like staring out the window, they're daydreaming, they're not focused, and it's hard for them to sometimes regulate their emotions, to control the expression of their emotions. But for the most part, the problem behaviors occur in school because they're seen as not paying attention. With the attention deficit with hyperactivity, we tend to see that behavior where the kids are kind of bouncing off the walls, they can't sit in their seats, they have difficulty taking turns, they don't listen to directions because they act on impulse without thinking about the consequences of their behavior. And so all of that gets lumped together under ADHD and ADD, and a lot of people will treat both types of disorders in the same way, but they really require different types of treatment. And the confusing thing is, for both, adults will say of their kids, well, they can be on a video game for hours, so how are you telling me they can't concentrate? Well, they can't concentrate on certain types of information. But if the behavior is, if it's a new behavior or if it's really interesting and engaging, then yes, they can pay attention. Otherwise, it's very difficult, and they have problems organizing themselves, they have problems preparing to organize, and sometimes they have problems remembering what they've done. So that's why I said there are those three core areas of emotion regulation, attention and concentration, and I forgot the other one that I just said. Control, maybe.
Janae, in reference to, how you said, no bad kids, their needs that are unmet. So likely for like the school-age children to adolescents, you may see individuals act out, which it's kind of like they're being defiant, oppositional defiance, or considered like conduct disorder. So I would recommend that a parent or parents would, set boundaries, set limits. You don't have to beat them, but you need to, say, hey, this is what it is, and you have to be firm about it. Because once a child or, a kid kind of figures that, hey, I can get my way if I do X, Y, and Z, then they're going to continue on with that behavior. We don't want to call it bad, but it needs to be corrected.
Mm-hmm.
Thank you for that, and I think that that's important. Again, as we're talking about treatment, I think sometimes we think about sort of like the most common treatments of, perhaps, a stimulant or a Vyvanse or something like that for ADHD or ADD. But a lot of times that treatment looks like family therapy. It looks like, how do we teach parents positive parenting strategies to eliminate some of those behaviors? So thank you. Now, this next question actually comes from our Facebook and YouTube viewers. Petra, you talked a little bit about alternative therapies earlier. Can anyone speak to acupuncture as an effective treatment for some mental health conditions when folks are resistant to taking more traditional types of treatments or medications?
I cannot speak to acupuncture. I don't know anything about the acupuncture. Maybe my fellow can.
I can't speak in terms of the effectiveness aside from what other people have said. So I have heard other folks, even a psychologist that I met recently, mention that she gets involved in acupuncture and that it has a significant impact on her mood. But one of the things that she said about it is it's not a replacement for therapy. That it should be a part of, if you're going to use it, that think about using it in addition to traditional therapy, but not to replace it. But that's about all I can say because I haven't really looked into acupuncture.
Okay, thank you. So as we get ready to wrap up, just wanted to talk a little bit about resources and supports. This has been an absolutely amazing conversation. We've discussed a lot. I think we've unpacked quite a bit, clarified some things, but it's also important to have takeaways. What's next, right? Where do we go for help? How do we get treatment? And so this last slide that we have, we've got some local community-based resources for folks that are looking for what's next, whether it's for them or for their family members. Can we have that last slide, please? Thank you.
And while they're waiting, I just want to encourage folks to look at the websites, have conversations with family and friends about the websites. Just look to see what you can see. Just get some information. And as you make conversations, again, be very clear that you are asking for a consultation. The consultation word is important because you don't want to get charged for that consultation session, but you are seeking information. And as you set up an appointment, a consultation with a provider, it's to seek answers to your questions. And look at it as try to maintain an attitude of curiosity. And even when you do decide on someone, know that just like when you look for a doctor, sometimes you change doctors because you don't feel that you were heard. Think about it the same way as a therapist. Don't allow a bad experience with a therapist turn you off to the idea of therapy because your mental health is just too important.
Absolutely. And just on a note to that, again, with regard to resources, when folks have insurance, on the back of that card, many people have behavioral health coverage. There is an 800 or should be an 888 number on the back of your insurance cards where you can call your insurance company to find out providers that are in network. Again, like Dr. Leslie said, you can just ask questions. You can seek consultations. The most important thing is to get your needs met. Get the needs met, of your family members, and there are resources and supports out there for that.
I was just going to say that your family doctor can also be a good resource. If you ask your family doctor for a recommendation of a therapist, they should be able to provide that to you as well.
All right, thank you, ladies.
Wow, what an amazing day we have had this morning. I am absolutely thrilled to be able to come and just say thank you, panelists. Thank you so much for being with us today where you could be so many places. But I declare this virtual symposium sharing with each of us and all of you why mental health matters in the African American community. Every one of our panelists, you ladies are rock stars within your profession and within the communities that you serve. My heart is extremely happy. When you talk today, it just reminded me that normalizing health-seeking behavior is essential to our well-being. Dr. Leslie Bezalou, Ms. Janae Price, and Ms. Petra Edwards, informative information, timely information. This information sharing is essential as we deal with this pandemic or endemic, whatever terminology. Mental health matters within our communities. The stigma must be broken, and having these conversations like today really helps that. Self-care for each of us, I love it when it was shared how it should be sustainable. But within sustainability, the criticality of setting boundaries. Standing before you as the chairperson for this Women's Day season has given me this opportunity to have worked with some awesome people that are transcending how important, despite not being able to gather socially in mass numbers, but yet we can still provide amazing events and activities that are beneficial to the community. And none of this would be possible today as we continue to navigate through this pandemic or endemic if we didn't have the toolkits provided to us with the information that our panelists provided today. So again, thank you panelists for the fantastic job that you each have done today. We really appreciate it. Now, what about this moderator today? My goodness. Ms. Tara Roberts Davis, thoughtful, professional. She's a superstar, and we absolutely love and adore her. So we appreciate you taking time out to be on point and be on task to be with us on this day. Now, the two co-chairs for this virtual symposium, none other than the great Robbie Diamond and the magnificent Sarah Gay. Girls, you all get atta-girls today, pats on the back. All of the planning and coordinating has simply been spectacular. Job well done to the both of you and your entire committee for the works that you've done. I personally appreciate it. I tell you, an excellent presentation, and I'm so grateful that we have a pastor in Pastor Blakely and Scott, and our First Lady Scott, that allows us to do such events and activity. I'm grateful for our pastor and how he gives us these platforms and opportunities. Now, none of this also wouldn't be possible if we didn't have people like Ms. JP, Mr. Matthew, Corey, Lillian, the entire technology committee and media committee, our public relations committee, my dynamic and sweet vice chair, Renee Evans, and all of the ladies that are so supportive being a part of this Women's Day steering committee that supports me. I say again, my heart is full and happy because today was just spectacular. So this delightful event, it ends here, but the conversation should not end. I stand as a poster child for therapy. I am an advocate and a proponent of it, being one that has been going through PTSD therapy for over nearly 10 years through my services with the military. So I share with each of you how critically important your mental health is. So I am a poster child, and I know I'm not crazy. So I say to each of you that are listening and viewing, by all means, if you know you need help and support, do not be ashamed of the stigma. Get the support that you need. So I'm absolutely proud of this continuation of the dialogue and the conversation. Normalize health-seeking behavior, talk therapy. All of these things are so important as we continue this dialogue and this conversation. So Women's Day Culmination will be Sunday, May 15th, Sunday school at 9:15 to 10:15, and our services begins promptly thereafter. So if you're in the area, by all means come and support us as we move towards the finish line in terms of Women's Day season. Today, we are doing a drive-through and a financial drop-off for the Palmetto's Children Home. For those that desire to drop anything off, you may support us in that way in terms of items that can be used to support household needs for Palmetto Children's Home. But again, job well done. Wonderful event today. This our virtual symposium with the theme Mental Health Matters in the African American Community. Again, thank you, Dr. Bezalou, thank you, Ms. Price, and thank you, Ms. Edwards, and for each of you that have supported us on this day. Congratulations again to a job well done. This concludes our activities for this morning. I turn it back over to the moderator, who will give us final words. Ms. Roberts-Davis, thank you again.
Thank you again. Thank you for having me. And I cannot think of any more appropriate final words than to read a comment from one of our Facebook Live viewers. I am 70, and my generation, women weren't taught self-care. As a parent, I took care of my family, then caring for a sick husband until he died 5 years ago. Now I find I needed to take care of myself. I know taking self-care is very important and has helped me to talk to a therapist to help me process my feelings. Again, this highlights what has been said throughout the day. Mental health matters, and it's so important that we take care of ourselves, take care of each other, and continue to have conversations like this. God bless you all.
Doing the panelists, and then we're going to ask Mamie and Renee, Dr. Hayes Hartwell and Renee to come forward. We're all going to meet here in the center. We just want to officially thank everyone for being involved, for all that you've done. And of course, we want to give our flowers to our Women's Day Chair and Vice Chair. We're going to give flowers to them while they're living and can appreciate them. And so, thank you all so very much. We're going to get a pretty picture right here in the center and face out to that camera if you all don't mind. Thank you. All right, thank you, ladies. Be dismissed. Thank you.
Wonderful. Real quick, girls. Renee, come stand back.
Oh, you want a picture?
Yeah. All right. And then, yeah, y'all come on in. Tighten this up. Y'all look at the camera real quick. We will, trust me.
Okay. Then come talk.
Thank you. All right, and stay in place. Okay. While we're there, the lady and I will step out. In the center,
You're in the center between them. There you go. Come on. Yeah.
Is that your phone?
Thank y'all.
Okay. All right, Sarah.
Thank you.